Right. So, hi again, everyone. My name is Dr. Khaled. I'm one of the doctors in UK, and today we're going to speak about Plab 2 general approach, which is a very important topic. Actually, we tend to use it in almost every single station in the Plab 2 exam. So we are running a course very soon. So please subscribe, and you're going to get very beneficial information about how to deal with your Plab 2 exam in a very structured approach. So we're going to start now. A little bit of information about myself. My name is Dr. Khaled. I'm one of the NHS doctors. I graduated in 2011 in Cairo University in Egypt. I managed to pass my Plab 1 exam in 2018 and my Plab 2 exam in 2019. I got my first job in the NHS in 2020, and then I joined the GP training program in 2021. I started giving Plab 2 mock exams in 2019 up till now. And obviously, like we said, the Plab 2 course is going to start very soon. So please keep yourself updated with that. So let's speak about the general approach in Plab 2. So it's very important to consider whether is it the first presentation or is it the second presentation or is it a follow-up appointment. So let's speak about a first presentation. So a very important mnemonic which is called GRIPS. So GRIPS is very important to keep in your mind whilst you are introducing yourself, whilst you're dealing in the first few seconds with your patient. So GRIPS, what does it stand for? So GRIPS, so G stands for greet the patient, say hello, wait for the answer from your patient until they hello you back, then build rapport with your patient by smiling. Okay, it's very important to keep an eye on your body language. Keep an open body language. It's very important in your exam. It shows the role player, shows the examiner that you are confident in yourself. Then I stands for introduce yourself. How to introduce yourself is very important. Everyone has got their own ways of introducing themselves. You can say, my name is Dr. Khaled, for example. I'm one of the junior doctors in this department or surgery. Please, it's very important, keep in your mind there is a difference between department and surgery. So department is actually if you're working in hospital, surgery if you're working in a GP practice, okay? So again, my name is Dr. Khaled, one of the junior doctors in the department or in the surgery. Are you Mr., for example, John Smith? Okay. May I confirm your name, which is very important. So either are you Mr. John Smith or may I confirm your name, please? Okay. And then how would you like me to call you? It's very important here because you may think the patient's name is John and they would like to be called by John. However, some people would like to be called by their surname, for example. So you can say, how would you like me to call you? So the patient might say, oh, you can call me John, doctor, thank you. You can call me Mr. Smith, for example, okay? How would you like me to call you? Would you confirm your age for me, please? So that's another way of confirming the patient's information. So that's important. Then P stands for purpose of consultation. How can I help you today? It's a very important question because it's actually an open question, a question that actually gives the opportunity to the patient to start speaking to yourself about their condition. And believe me, it's a very important question because during the first minute, which we call a golden minute, the patient might give you almost everything you need to know about their condition. So please try to be an active listener during the first minute and ask the patient an open question at the beginning. It's very important. We'll give you enough information that you need to know in the beginning, which is quite important. Then S stands for smile, okay, which is a very simple thing. I know under the stress of exam, sometimes people tend to be worried and to be anxious and they forget to smile, but please, smiling will put patient at ease, the role player at ease. It will actually put yourself at ease at the same time. So please smile during the exam. Okay, it's very important, unless it's you're breaking bad news or something like that. So that might be slightly inappropriate. However, smiling would also like break ice between yourself and patient. So again, grips, the early beginning. So G stands for greet the patient, R for rapport, I introduce yourself, P purpose of consultation, how can I help you today? An important open question, and then S for smile. So that's for the first presentation. If it's a follow-up presentation, or if it's like an admitted patient to the hospital, so it's quite similar to this one with just minor few differences. So G again greets the patient, say hello and wait for them to hello you back. Then R for rapport, and I for introduce yourself, like we said earlier. Again, like we said, my name is Dr. Simon. I am one of the junior doctors in this department of surgery. Are you Mr. James Brown? May I know your name, please? What can I call you, or how can I call you today? What your relationship to Mr. Elliot Jones? For example, if you're speaking to a patient relative or a next of kin, so you would like to confirm the relationship. Are they like brothers, sisters? Are they like parents to the patient or something like that? So it's very important as well to try to understand what is the relationship to the person you're speaking to, which is very important. P, purpose of consultation. I understand that you are here today for a follow-up appointment. Okay, I understand you've been admitted to the hospital for the last 5 days. So this gives information to the patients that you know about their situation, even if it's your first time to meet them, but the patient was admitted to the hospital a few days ago, and you've got some information, you've gone through their notes before you speak to them, okay? I understand you had some blood tests, investigations done, okay, today, and you're here for them, or you're here to hear about your blood test and investigation results. Am I correct? Okay, so again, G stands for greet the patient if it's a follow-up appointment. R for rapport, I introduce yourself. P, purpose of consultation. Then another P, prior understanding. Has anyone explained those investigations to you, Mr. Joan? Okay, never, please, doctors, please never assume the patient knows about his situation. And never assume the patient doesn't know anything about what's going on. For example, if a patient comes to you, he's already met like the gastroenterology doctors or something like that, and he had a camera test. And during the camera test, the doctors mentioned, or after the camera test, immediately the doctors mentioned to the patient, oh, it's fine. You don't think that you've got any problems with your gullet. It's just like inflammation of your gullet, and that's it. Okay. So the patient might get a hint about what's going on with themselves. So that's very important. Never assume things while you're speaking to the patient. Okay. So has anyone explained those investigations to you? What have you been told about your condition so far? So address the patient understanding, okay, about their situation. Has anyone explained your father's condition to you? Can you tell me what has happened so far so that we both understand the same thing? Okay, so prior understanding is very important. Like I said, not to assume the patient doesn't know anything about their condition, or never assume the patient even knows anything about their condition. So ask questions. That's the way you can understand where is the patient coming from. And again, S for smile. Okay, so that's quite similar actually, apart from like minor few things, including prior understanding, which is very important while speaking to a patient during a follow-up appointment, or if the patient is actually admitted to the hospital. Right, so history taking. So it's important, like I said, very important to take a focus history. So taking a focus history. So if a patient comes to you with pain, okay, if the patient comes to you in pain, very important, the mnemonic Socrates. Probably most of you know about that, but we're going to go through it again very quickly. So Socrates, if a patient comes to you in pain, so S stands for sight. Where is the pain? Can you show me where the pain is? Can you show me where it hurts? Onset, did the pain start suddenly or gradually? Okay, onset of pain is very important. character of pain. What type of pain is it? Is it a dull ache? Is it a compressing pain? Is it a sharp kind of pain? It's very important. A very important question here, doctors. Do you ask patients about the type of character in the same question? So for example, Mr. Smith, have you got a sharp kind of pain, or have you got a dull ache kind of pain? Okay, so never ask this type of question, because you might be misleading the patient. The reason behind me asking and saying this is actually some patients they find it difficult to describe what kind of pain they've got. Okay, so if you say, oh, have you got a dull ache type of pain, or have you got a sharp pain? Okay, so the patient might say yes, however, it's not the situation. So just let the patient explain what the character of their pain is. What kind of pain is it? Can you please explain that to me? Okay, then R stands for radiation. Okay, does the pain go anywhere else? And A stands for associated symptoms with differential diagnoses. Okay, very important to ask about differential diagnosis here whenever you're asking about pain. Okay, timing, is there any specific time you experience this pain in? Okay, is it always there? Does it come and go? Which is very important as well. Exacerbating factors and relieving factors. So is there anything that makes the pain worse? Is there anything that makes the pain better? S stands for severity and score. On a scale of 0 to 10, where 0 being no pain and 10 being the worst pain, how would you score your pain for me? Okay, to understand how severe the pain is at the moment. And F stands for frequency. If you like to ask that, that's not included in frequency, is not included in Socrates, but you can still ask about it, which is also can be very important for frequency. Is it the first time you have this sort of pain? How often do you get this pain? Okay, so Socrates, if the patient comes to you in pain. However, if the patient comes to you with different other symptoms, okay, for example, if a patient comes to you with rash, so that's a different mnemonic here, which is called foot para. Okay, so F stands for frequency. Is it the first time you have this sort of pain? I'm sorry, this sort of rash. How often do you have this rash? Okay, if it's rash, actually, so you ask frequency. O stands for onset. So did this rash like come on suddenly or gradually? D stands for duration. When did it start? And P, progression. Is it getting any worse, or is it improving, or is it the same? Okay. A stands for aggravating factors. Anything that makes it worse. R stands for relieving factors. Anything that makes it better. A stands for associated symptoms, the differential diagnosis, like we said. So foot para for any other symptoms apart from pain. However, if it's pain, so we said Socrates. Differential diagnosis, it's very important whenever you're speaking to your patient with any symptom that's related to any of these systems. Very important to try to ask about the other relevant symptoms. For example, if a patient comes to you with chest pain, so it's very specific to ask about breathlessness, any dizziness, any palpitations or fast heartbeats, any ankle edema or insomnia, okay? So all of these symptoms can be associated with chest pain. So it's very important to ask about these questions. System review, whenever you're speaking to your patient, very important to relate all of these together. Try to keep them in the back of your head. Very important. Chest pain, breathlessness, dizziness, palpitations, ankle edema or insomnia, all of these symptoms can be related to each other. Okay, so if the patient doesn't volunteer and say, oh, doctor, I have got breathlessness, or I've got like fast heartbeat or something like that, you still need to ask about them. GIT as a system, so ask about appetite, weight loss, weight gain. If the patient comes to you with abdominal pain, for example, as a symptom, please ask about weight loss, loss of appetite, ask about nausea, vomiting, diarrhea, constipation, hematemesis or vomiting of blood, or indigestion. Very important. Please keep them in your mind. CNS, again, headaches, numbness, weakness, any seizures, which can be related, problems of vision, hearing problems, dizziness, all of these symptoms can be related to each other. okay? Respiratory, like cough, phlegm, hemoptysis, wheeziness. If a patient comes to you with chest infection, so they say, I've got cough. So very important not to omit to ask about whether is it a dry cough or is it a productive cough, okay? If they're coughing up any blood, if they got any wheeziness, which is very important. Genitourinary symptoms. So is there any pain during urination, any blood in urine, any incontinence, hesitancy, any discharge from the private parts, any nocturia, or any like frequency to urinate in the evening or at night whilst they woke up whilst they are asleep and go to the toilet many times, okay? Terminal dribbling, which can be something related to like benign prostatic enlargement or even prostate cancer. So it's very important to ask about this question. And also dyspareunia. If you're thinking this patient has got like an STI or something like that, sexually transmitted infection, very important to ask this question. Musculoskeletal as well, joint pain and rash. So all of these symptoms can be in a system review kind of thing, so you can relate them to each other, which is very, very important. Risk factors, very important to think about whether does this patient smoke, do they drink alcohol, for example. So risk factors. Also, never forget about illicit drug use. Very important to keep that in your mind whilst speaking to your patient. However, at the same time, please use these risk factors in place. So for example, if a patient comes to you with chest pain, it's actually relevant to ask about sexual history here, okay? So very important to ask about risk factors, but again, please ask them in a relevant manner. Red flags, which is very important as well and can be related to differential diagnosis. So if a patient comes to you with chest pain, so is it a muscular chest pain, for example, or is it anginal chest pain? So red flags. So you ask about if this pain actually being referred, okay, have they got any like pleuritic type of chest pain when they breathe, and do they get any sort of pain, or does the pain gets worse? Okay, so red flags, any arm weakness, leg weakness, okay, if you're concerned about TIA or stroke, okay, red flags. All of these things should be asked in history taking, whilst you're taking history from your patient. Maftosa. Has anyone heard about maftosa? So it's quite common mnemonic. I'm going to go through it very quickly again. So very important. M stands for medication. Are you taking any regular medication, including over-the-counter medication? Are you on any type of contraception? If you're speaking to a patient who's actually in a childbearing age, or a patient after menarche, so very important to ask her about contraception. But again, that doesn't mean you should ask every single female patient about contraception. Only ask if you do think it's actually related. Okay, so I see lots of doctors who actually ask about contraception in patients who are actually in a childbearing age. However, it's not relevant. So if a patient, for example, comes to you with headaches, like severe onset of headaches, and you think she might have got like a subarachnoid hemorrhage or something like that, so contraception might be a little bit of irrelevant here, okay? Allergy, never forget about allergy. Are you allergic to anything specifically if you're going to prescribe something like an antibiotic or something like that? If the patient says yes, so what happens when you take it? For example, if you're going to prescribe penicillin for your patient, okay, so if you're like concerned about sinusitis, you're going to prescribe penicillin. So the patient might say, oh, doctor, I'm allergic to penicillin. So let me ask you, what happens when you take penicillin? The reason why I'm asking this question is some patients tend to get severe symptoms like angioedema or lip swelling, or they are actually unable to breathe. Some people tend to get just mild rash. And if you haven't got, for any reason, any alternative to prescribe your medication like penicillin, so still patient can be prescribed it, given the fact that they are not completely severely allergic to it. Okay, so it's very important to ask about what happens when you take this sort of medications that you're allergic to. Right, okay. Then, family history. Is there anyone in your family with similar conditions? Just to make sure. Some conditions can be hereditary, some conditions can be related actually to each other. Some conditions can run in families. So very important to ask about the family history. Travel history. Have you traveled anywhere recently, like abroad recently? And if yes, where did you travel? So very important as well, like I said, to make sure the patient hasn't traveled if it's relevant, again, only if it's relevant. To ask about travel history, if you do think the patient has got like a tropical infection or something like that, because basically some conditions are only related to travel history, such as like malaria or something like that. So very important to ask about travel history if it's related to the situation, and ask about where have they traveled to if they say yes. Occupation, what do you do for a living? And if retired, what do you see? Or what do you use to do for living in the past? And actually, it's very important, again, occupation history can be related to some conditions such as like mesothelioma or something like that. If you do think the patient might have got like developed like lung cancer or something like that. So very important to ask about occupation. Occupation, very important, okay? Social history, accommodation. Whom do you live with? Are you married? Do you have any children? Do you live in a house or a bungalow? Do you work independently for elderly patients or patients with disabilities? Why social history is very important. So let's imagine you're going to prescribe painkiller, specifically something like codeine or morphine or something like that, which causes, one of the side effects of codeine and morphine is actually dizziness. And you can imagine you've got a patient who's actually in their 70s or 80s and they live alone. Would it be appropriate if you consider something like morphine or codeine? Might be less appropriate at that situation if the patient lives on their own, because that makes them prone to falls. So that's not fair. So the patient might fall and they might bang their head, they might get bleeding, intercerebral bleeding, or they can get like fractures or something like that. So very important to ask about whether they live on their own, whether they live with someone. Again, these questions should be relevant, and you shouldn't ask these questions in every single station. Okay, so only if you think it's actually related to the station. Okay, then S stands for stress. Is there anything that's causing you stress in your life? Okay, like any unusual stress in your life, you can still ask about this as well. Okay, so stress can be related. Patient comes to you, they are struggling to sleep at night. Unless the patient volunteers and says, oh, doctor, I've been through a lot. Recently, I'm struggling to sleep, all of that stuff. So again, if the patient says struggling to sleep, so never omit something important such as stress. Okay, because basically stress can affect their sleeping, can affect their mood negatively. So S stands for stress. Never forget about this. Again, another S stands for smoking. Do you smoke? If no, have you ever been a smoker? That's very important. I would appreciate if you all doctor just like use themselves, please. Every single doctor. Thanks so much. And again, it's gonna the meeting itself is gonna run out in a few minutes. After running out, I'm gonna reshare another one. So thanks so much for bearing with us. And please keep yourself muted, doctors, if that's okay. Thank you so much. Right. So smoking, again, is very important. Smoking. What do you smoke? Okay, so some patients actually, they say, when you say, do you smoke at all? They say, yes, I do smoke, doctor. And then later on, you discover that they're actually smoking not cigarettes, but just vaping. So vaping in the UK can still be considered as smoking. Okay, so very important to explore what do they smoke. Do they smoke cigarettes? Do they smoke cannabis? Okay, joints and all of that stuff. Very important. Okay, if yes, for how long have you been a smoker? How many cigarettes, if they do smoke cigarettes per day? Okay, how many cigarettes per day? Very important. Alcohol, do you drink any alcohol at all? If yes, again, how many units per week? Anyone knows how many units per week shouldn't be exceeded in the UK of alcohol? So the maximum amount of alcohol per week in the UK shouldn't be exceeding 14 units for males and females. Okay, and shouldn't be drank all at once. So if a patient or if someone is going to drink alcohol during the week, should be as max as 14 units, and again should be divided during the week. So you shouldn't like drink 14 units on one day on a Saturday night or something like that. Okay, so that's also important to keep in mind, because if the patient says, oh doctor, I drink like 15 cans of beer a week. Okay, so explore more, explore when do they drink these 50, like do they drink 50 cans in one day or something like that? And again, makes sense actually to think about, oh, that actually definitely exceeds 14 units a week. So you can give patient some lifestyle advice about cutting down the amount of alcohol they drink. Okay, exercise, are you physically active? Which is important. Diet, what kind of diet you have? Okay, tell me more about your diet. Sometimes you can ask this question. However, this question can still waste some time, because when you ask the patient about their diet, they might say, oh, doctor, I eat everything. I eat junky food. In the evening, I eat, my dinner is actually full of cereals, is full of like burger, sausage, all of that stuff. So that can still consume sometimes. So you can say, do you eat any junky food? Do you eat any spicy food? If you want to ask about diet in a specific way. Okay, anything else? It gives the opportunity to the patient to tell you if they've got any other things that they would like to speak to you about. Is there anything else you would like to tell me about your condition? Okay, very important. So maftuza, very important to keep in your mind during history taking. Sexual history, again, it's important to consider whether actually your patient sexually active. If asking about the sexual history, is it something to add into your station? Is asking about sexual history very relevant here or no? Because remember, at the end of the day, sexual history is something that actually can be a little bit sensitive. So you shouldn't be asking about sexual history unless it's actually related to the station. Okay. I need to ask you a few personal questions about your sexual life to get a better understanding of your condition. If you feel uncomfortable at any time, please let me know. So I need to ask you a few personal questions about your sexual life to get a better understanding of your condition. If you feel uncomfortable at any time, please let me know. Then you start asking sexual practice. Are you sexually active? Is your partner male or female? Do you practice safe sex? By this, I mean, do you use any condoms? What kind of sexual intercourse do you usually practice? Oral, vaginal, anal. Very important, doctors, to keep in your mind the list of questions they ask if you do suspect the patient has got an STI, a sexually transmitted infection. Okay. When was your last sexual intercourse? Have you traveled abroad? Because some patients tend to have sexual intercourse when they travel abroad, and then they can still get or gain infection whilst doing that. Okay, and sexually transmitted infection. Relationship, are you in a stable relationship? Any previous infections in testing? Have you ever had a sexually transmitted infection in the past? Have you ever been tested for any sexually transmitted infection like HIV, chlamydia, gonorrhea? Okay, so relationship, very important. Will give you a clue whether if there is an STI suspicion or not. Okay, symptoms. Are you experiencing any discharge from your private parts, like penis, vagina? Any burning sensation when passing urine? That can also still one of the symptoms of sexually transmitted infections such as chlamydia, gonorrhea? Have you noticed any ulcers or lumps in your private area? And are you running any temperature? Okay, so these are symptoms that you can ask the patient about. You can have a little look into them. At some point, I might share them as recorded, and then you can stop the video. You can have a little look into them, all of these symptoms. Keep them in your mind whilst you're asking your patient these questions. Partners, is there any chance you could have any other partner? How many partners did you have in the past 6 months? Is your partner experiencing any symptoms such as discharge from your private parts, pain or lumps anywhere? Last thing, which is still important, tracing contacts. Did you have sexual intercourse with your partner after that? Because basically the patient had sexual intercourse with another partner, and then again they have sexual intercourse with their main partner, they will definitely transmit this infection to them. So very important to ask about whether after having the incident of sexual intercourse, have they had sexual intercourse with their main partner or not? What kind of sexual intercourse did you have with your partner? Is there any chance you could have sexual intercourse with anyone else after that? Okay, because we need to trace, we need to know who else might have been affected. Okay, sexual intercourse. Menstrual history, again, like we said, menstrual history should only be asked if it's relevant. Okay, when was your last menstrual period? Are your periods normally regular? Okay, so here, if you want to rule out something like ectopic pregnancy, here, if you want to rule anything like dysmenorrhea, or if they have got like a PID or something like that. So these questions, very important to ask about. How many days do you bleed? How many days in your menstrual cycle do you pass any clots? Are your periods painful? Are your periods heavy? Okay, so menstrual history is very important whenever it comes to a patient whom you do suspect they might have got endometriosis, PID, like pelvic inflammatory disease, if they got ectopic pregnancy. Okay, so these are very important in that situation. Drug abuse history. So if you want to speak about recreational drugs, is there any chance you use recreational drugs? What kind of drugs do you use? How do you take these drugs? Like do you smoke, do you inhale, inject, sniff? For how long have you been taking them? Do you use any other drugs? Very important, because basically if the patient uses, like they sniff cocaine, so you never assume that they don't do anything else like heroin, like cannabis. Okay, very important. Who do you do drugs with? Okay, if you stop taking these drugs, do you develop any withdrawal symptoms? All right, okay. So that's very important. Recreational drug history, recreational drug history. Right. So the first part of our tutorial today is going to end now. We're going to start another tutorial in a few seconds because it's going to stop here as a Zoom session. I'm going to send the link to the group, and please rejoin, doctors. Thank you.